When should I consult a doctor for clear watery discharge?
Hey there! Welcome to today's video, where we'll be discussing an important topic, clear watery discharge. If you've been experiencing clear watery discharge and you're unsure whether or not it's a cause for concern, this video is for you. We'll be addressing when you should consider consulting a doctor regarding this issue. So, let's dive right in.
What is clear watery discharge?
Before we discuss when to consult a doctor, let's first understand what clear watery discharge actually is. Clear watery discharge refers to a fluid that is thin, transparent, and has no color or odor. It's a natural secretion produced by the glands in the cervix and vagina, and its main function is to keep the vaginal area clean and lubricated.
Normal versus abnormal discharge.
While clear watery discharge is typically considered normal, it's essential to be aware of any changes in its characteristics. If you notice any significant changes in the color, consistency, odor, or quantity of your discharge, it may indicate an underlying issue. Some abnormal signs to watch out for include yellow, green, or gray color, foul odor, thick, clumpy, or cottage cheese-like consistency, burning, itching, or irritation. If you experience any of these abnormal symptoms alongside your clear watery discharge, it's advisable to consult a doctor.
When to consult a doctor?
Now, let's get to the main question. When should you consult a doctor for clear watery discharge? While clear watery discharge is usually harmless, there are a few instances where medical attention is recommended. 1. Excessive discharge. If you're experiencing a sudden increase in the amount of clear watery discharge, it's worth consulting a doctor. Excessive discharge can sometimes indicate an infection or hormonal imbalance. 2. Accompanied by other symptoms. If your clear watery discharge is accompanied by other symptoms like itching, burning, redness, or pain in the genital area, it's essential to seek medical advice. These additional symptoms could be signs of an infection or other underlying conditions. 3. Abnormal color, odor, or consistency. As mentioned earlier, if your discharge becomes yellow, green, gray, or develops a foul odor, it's recommended to consult a doctor. Similarly, if the consistency changes to a thick, clumpy texture, medical attention is necessary. 4. Unusual bleeding. If you experience clear watery discharge along with unexpected bleeding, especially between periods or after sexual intercourse, it's important to reach out to a healthcare professional. 5. Concerns or worries. If you have any concerns or worries about your clear watery discharge, it's always better to err on the side of caution and consult a doctor. They can evaluate your symptoms, provide a diagnosis, and offer appropriate advice or treatment if needed. Remember, it's better to consult a doctor and have your concerns addressed rather than ignoring potential signs of an underlying condition. And there you have it. We've discussed when you should consult a doctor for clear watery discharge. While clear watery discharge is generally normal, any significant changes in color, consistency, odor, or the presence of accompanying symptoms should prompt a visit to the doctor. Your health and well-being are important, so don't hesitate to seek medical advice if you have any concerns. Take care of yourself, and we'll see you in the next video. Bye!